Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at Tzanch smear. So we're looking at Tzanch smear and the cytological findings. So under Tzanch smear, first is it acts on the erosive, vesicular or bullous or the pustular skin lesions. Next, what is done is acts on the acantholytic cells. So this can be either positive or negative. Now let's look at it being negative. So in case of negative, what are the things seen? So in case it is negative, it can either be inclusion bodies. It will be inclusion bodies. So under inclusion bodies, there can be the Henderson-Patterson bodies. So if it's inclusion bodies, it can include the Henderson-Patterson bodies. Henderson-Patterson bodies. Next is the inclusion bodies. It can also include the Leishman, the Henderson-Patterson. It suggests it is molluscum contagiosum. Means it is molluscum contagiosum. The other inclusion body is if it is a Leishman-Donovan body. Leishman-Donovan bodies. So in case it's a Leishman-Donovan body, as the name suggests, it is for leishmaniasis. Next, moving on, we look at atypical squamous cells. So in case of atypical squamous cells, it is nothing but the squamous cell carcinoma. Next, in case of clusters of the basaloid cells, cluster of basaloid cells, it will be the squamous cell carcinoma. Then cluster of basaloid cells is the basal cell carcinoma. Then in case of no acantholytic cells and plenty of leukocytes. So in case of no acantholytic cells and plenty of leukocytes. In case of plenty of leukocytes, so in this case it can either be the bullous pemphigoid, B pemphigoid, it can be the Stevens-Johnson syndrome, or it can be the erosive lichen planus. Next, we look at, just to recap what we did, we saw what happens negative in case of acantholytic cells. So in case of inclusion bodies, we discussed the Henderson-Patterson, it is for the molluscum contagiosum. Then we also discussed the Leishman-Donovan, it means it is a leishmaniasis. Then atypical squamous cells is for the squamous cell carcinoma, and cluster of basaloid cells is for the basal cell carcinoma. Now moving on to if the acantholytic cells are positive. So in case it is positive, what are the findings? So if it is positive, we look for multinucleated giant cells. So in case of multinucleated giant cells, it will be positive. So if it is positive, it stands for the herpetic infections. Next, in case it is corpse rond grain, in case it is corpse rond grain, it means it is a Darius disease. It is nothing but Darius disease. Next, when it is multinucleated giant cells, it is negative. So, in case of multinucleated giant cells, it becomes negative, and in such a case, so multinucleated giant cells, it being negative, and just a small correction. So, in case if it is multinucleated giant cells, upon being negative and upon having the corpse and grain, so when these two conditions are met, upon it being negative and upon it having the corpse rond grain and positive dyskaryotic acantholytic cells, this means it is nothing but a Darius disease. Next, moving on, in case it is negative and has a DIF positive. So, in case it is DIF positive. So, when it is DIF positive, it means it is the pemphigus. And in case it is DIF negative, this stands for the Haley disease. This is Haley disease. Next is the dyskaryotic acanthotic cells. There is dyskaryotic acanthotic cells. So, in such a case, that is it has plus or no or little inflammation. So, it has no or little inflammation. So, in such a case, it is nothing but the staphylococcal scalded skin syndrome. Staphylococcal scalded skin syndrome. Next, we move on to the dyskaryotic acantholytic cells. We look at the dyskaryotic acantholytic cells and the cocci. So, in such a case, it is nothing but the bullous impetigo. Next, in conditions where there is a degenerated necrosis, in condition of degenerated necrosis, keratinocytes, and there is leukocytes, fibroblast. So, in such a case, it is nothing but the TEN. So, dyskaryotic acantholytic cells and cocci, it is bullous impetigo, degenerated necrotic keratinocytes and leukocytes and fibroblast. This stands for TEN. The TEN stands for the toxic epidermal necrolysis. Channel.